A regular X-ray fails to provide critical information for implant treatment. So, with traditional X-rays, your anatomy is superimposed, so you see a really crystal clear image, and it's great for diagnosing normal dental disease such as cavities and generalized bone loss. But when we're examining a patient for implants, we really need to know the topography of your bone structure and identify key anatomical structures such as your sinus and your nerve relative to where you're missing your tooth. And really, we can only attain that information through a CBCT, which is a three-dimensional X-ray that allows me to assess your bone's height. It allows me to assess how wide your bone is and exactly where your sinus and nerves are within the jawbone itself. Here are the three things I check when I look at a CBCT. One, the bony contour. Two, the bone density. And three, adjacent vital anatomic structures. So let me go into detail. When I look at the ridge shape, I want to know if it's nice and flat and broad and tall, or if it's really knife edgy and skinny, or if it sort of tapers towards the cheekbone. And this is important because it helps me determine if I can go ahead and place an implant or if I have to do ridge augmentation procedures to prepare the site for an implant. Secondly, I also want to see how dense the bone looks. If the bone looks like it's going to be softer, then I have to tell the patient, hey, we can place an implant, but there's a good chance that I'll have to bury it and we're going to have to come back to do a second stage surgery to expose the implant. Or I can tell them, hey, there's a great chance that we'll be able to do a one stage surgery where I could put the implant and healing cap on, or even better, we might be able to immediately load the implant. And then lastly, we always make sure we look for the adjacent teeth, the sinus, or the nerve, because we don't want to create any kind of complications with our implant treatment. Dentists traditionally are not taught to read CBCTs the way oral surgeons are. Throughout dental school, you may be introduced to CTs in a class, maybe two, but most of the time you're using traditional 2D images, bite wings, and PAs to treat more conventional dental disease such as gum disease and cavities. It wasn't really until I started residency where the reverse became true, where I almost never looked at a 2D image anymore and was constantly looking at CTs. And that's been really beneficial because it allows me to navigate a CT well, fully comprehend what I'm looking at, and be able to interpret more information such as bone density or having a finer understanding of where anatomic structures are to the benefit of my patient. This patient came in with an x-ray and they thought they had plenty of bone for an implant, but unfortunately, they didn't have a complete picture of their situation. When you look at a panoramic X-ray, many times it can look like you have a ton of bone from the ridge crest down to the nerve, but that information doesn't tell you where the bone is spatially between the tongue and the cheek. So when we took the CT, what we came to understand was the tooth-bearing part of the lower jawbone, which is what we call the alveolus, was actually not in alignment with the body of the lower jawbone. So it hung closer toward the tongue. So that actually limited us with the amount of space that we had to place an implant. And if we went by what we saw in the panoramic X-ray, we would have placed an implant that would have been far too long. It may have then entered the submandibular fossa and it caused really significant bleeding postoperatively. That's why, I really do think the CBCTs are the standard of care when it comes to implants. CBCT is like GPS for implant surgery, and you shouldn't place one without it. Imagine driving across a country without Google Maps. You just hop in your car, drive, and kind of figure it out with the map as you go along. And, ultimately you can get to your destination, but your route's going to be a lot less efficient and you may run into more trouble, right? And that's how I feel about implants with traditional x-rays versus the CT, right? With the CT, you just have so much more information before you ever make that first incision to know what the patient has in terms of bone and how to properly prepare for it to ensure the patient has a smooth experience.